Hey, what's going on, Dr. Bo? Does chiropractic help with bedwetting? The technical term is called enuresis. You want to know? Stay tuned.
How can I help you today?
One of the most common questions that we get from new parents is, does chiropractic help with bedwetting? Usually this comes up right around age 1.5 to 3 years and up to 6, 7, 8 years of age, by the way. And it's a question that I probably field at least 2 to 3 times a month in our practice. So I want to kind of tackle that a little bit today, talk about what it does, it doesn't do, why chiropractic may or may not actually be an option for you if your child is dealing with a bedwetting situation. So the technical term around bedwetting, the vocabulary is that if your child is wetting the bed, if it's urinating more than one time a week and it's consistent. Now, typically, most patients will come into our practice and the parent will say, hey, Dr. Bo, my child has been dealing with bedwetting for a period of months. Matter of fact, they may have done well and then regressed, or you know what, hey, we can never ever seem to curb this. Is there something chiropractic can do about it? So I want to kind of address it, number one, from a structural perspective, and then number two, from a psychological perspective. So from a structural perspective, can chiropractic help, and how does chiropractic help? So I have my handy dandy little iPad here with me. And the thing about chiropractic and bedwetting or enuresis is that we know that the nervous system controls everything in the body. And sometimes when the signal from the nervous system to the portion of the body that's supposed to work, not work, or overworks tends to become stimulated or understimulated, we tend to see some different changes in the body. So for instance, if we are talking about a person that has neck pain, and if that area of the body is overstimulated or pinched, then the person will experience numbness and tingling into their hands. If we're talking about it from a child's perspective, and we are having issues having to do with nerves in the lower portion of the pelvis, that is when we typically will see a bedwetting issue. So with all of that being said, there are two different branches or nerve branches that go down and feed the bladder and feed the sphincters that allow the body to urinate. There is what they call the pelvic nerve and the pudendal nerve. Now, let me show you guys what these guys look like on structures here. So this is actually a moving structure right here. This is an app called 3D4 Medical. And as you can tell, that little nerve right there that's lighting up, that is the pudendal nerve. So this is the front side of the body. This is the pelvis. This is the right leg, the left leg here. And as I turn the body around, that is the nerve. These nerves come out of these little holes here. In the lower portion of the sacrum. Now, if you guys look at this structure, the sacrum, which is this bone right here, is actually ossified. It's together. However, in a child, the sacrum does not fuse together till about the age of 25 when you're an adult. So those are actually a bunch of little different bones. Yes, they're very close together. But if a patient or a child runs and slips and falls and hits those and kind of like, throws their back out of alignment or their sacrum out of alignment, then the nerves that feed into that, which come out of that area and go into the bladder, can be affected, and a patient or a child can be experiencing bedwetting symptoms. So the question is what do we do about it? Well, as a chiropractor, what I do is I check the structure and the function of the sacrum. I want to see how it's moving, if there's any restriction. Also, I'm also looking to see the correlation of not only the sacrum, but the bone or the ilium next to it, and the joint in between here called your sacroiliac joint, which connects the two. A lot of the times we'll notice that the hip is rotated out of position, or the sacrum is way anterior, way posterior, and that can cause a lot of dysfunction happening down in the lower portion of the sacrum, thus affecting the pudendal nerve. So what type of studies have there been done about it? Well, there's been lots of studies, but I just wanted to point out one to you that I thought was really interesting. They did a study of 171 children that were having 7 nights a week of enuresis or bedwetting. And what they found was this, is that after just 2 weeks of chiropractic care, 15% of those children stopped having any bedwetting issues. And after 6 weeks of care, over 50% of those children had 7 consecutive, what they call dry nights. Matter of fact, even in this article, it goes on to say that they call it a miracle cure with chiropractic. Now, what does that mean? It means this, and this is what I tell every single one of my patients that ask me this. Can chiropractic help with bedwetting? My answer is maybe. And I'll be honest, maybe it can, maybe it cannot. I've seen lots of patients have incredible success with it. We really work on structure and function, keeping everything in alignment and working appropriately. And then the second thing is like I said, there's some psychology behind it as well. A lot of times it can be a control issue with the child not understanding or wanting to go to the bathroom, or trying to hold it and they can't go to the bathroom. So, sometimes we have to talk and work with, a child psychologist with them as well. But from a pure structure and function point of view, I believe that chiropractic does some amazing things with kids having to do with enuresis. Now, if you have questions about that, please let me know down in the comments. I'm always here. I'm always wanting to learn more. I do a lot of research, especially on stuff like this. All right, guys. Hope you guys have a good one. Hope this helps you guys understand a little bit as far as why people say, have you tried chiropractic if your child's having bedwetting? Well, now you know. All right. Thanks so much.